The Centre for Disease Control and Prevention in the United States of America estimates that about 385,000 sharps-related injuries occur every year among healthcare workers in hospitals, and 86% of them are preventable. Needle stick and sharps injuries increase the risk of healthcare workers contracting hepatitis B and C, as well as HIV. Studies show that 20% of injuries occur before or during a procedure, while around 70% occur after the procedure but before disposal. This is also the most dangerous stage of administering medication for contracting harmful patient germs through needle stick injury. Only 10% occur during or after disposal. To tackle the problem of needle stick injuries, PD Medical engaged with infection prevention specialists in Australia and developed the Sharps Caddy. The Sharps Caddy is a world first and designed specifically to protect healthcare workers against sharps injury. The Sharps Caddy provides a complete ergonomic solution for use in administering drugs and the safe carry and disposal of contaminated sharps at the point of use. The Sharps Caddy includes compartments to hold hypodermic syringes and needles, a sharps container, and a variety of waterless hand hygiene bottles. Minimising the time between use and disposal makes PD Medical's Sharps Caddy effective in protecting healthcare workers from the risk of injury and infection. The Sharps container enables a nurse to attend to disposing of the needle and hand hygiene more efficiently following use, thus greatly minimising the risk of accidental injury and infection. The compact Sharps Caddy can be used for a variety of procedures, including intravenous antibiotics, subcutaneous injections, and intramuscular injections. As well as the Sharps Caddy, PD Medical has released a larger tray caddy, the AT Sharps Caddy, for aseptic procedures that require additional space for ancillary products. The AT Sharps Caddy, with the larger tray, is ideally suited for aseptic procedures like peripheral IV cannulation, blood collection, administering IV medication, and intramuscular and subcutaneous injections. Both the Sharps Caddy as well as the AT Sharps Caddy provide for safe loading of the tray with drugs, safe carrying, and safe and efficient disposal of contaminated sharp needles at the point of use. The caddy is stable in all modes of use, while loading the tray with drugs, during transit, and during disposal. It is strong, compact, and made for carrying, while keeping hand proximity away from contaminants and sharp needles. At the end of the procedure, the caddy is easily cleaned and stored, ready for the next use. Now let's see the caddy in use. The sharps container and hand wash bottles are easily fitted into the caddy. The caddy is wiped clean, ready for loading. The drug, syringe, and other ancillary items are loaded into the caddy at the loading station and then carried to the patient. Once at the patient, the caddy is placed on a flat surface and the procedure can commence. The proximity of the alcohol-based hand rub is a reminder to clean hands immediately before the medication is administered to protect the patient from harmful germs, including their own, from entering their body during a procedure. The sharps container enables a nurse to dispose of the needle immediately following use and minimise the risk of accidental injury. Remember that 86% of injuries are preventable, so having the container at the point of use removes a majority of risks at a time where the needle may be contaminated. Having the hand rub there is a constant reminder to attend to hand hygiene and is convenient to use immediately after contact with the patient to protect the health worker and the healthcare surroundings from harmful patient germs. Once the procedure is complete, the caddy is returned to the storage area, the non-sharps items are disposed of, and the caddy is washed, disinfected, and is again ready for use. The benefits at hospital ward level have been spectacular. At the St Vincent's Hospital in Australia, the rate of injury at this large hospital has halved since the compact Sharps Caddy was adopted. And what do the nurses think of our Sharps Caddy? They love it.
It's intuitive to use, and having the sharps bin and hand wash next to the tray allows us to do what comes naturally. A constant reminder of best safe practice with everything you need right next to you.
In a recent CDC article, it was noted that the cost of a sharps injury can be a compelling reason to use safer sharps practices. One sharps injury can cause a number of direct and indirect costs for the healthcare facility. In addition to costs incurred, the stress on the affected worker, their colleagues and the workers' families can be enormous. And where infection is acquired, current research papers suggest compensation per incident range between a few thousand to more than $1 million. In a cost-benefit analysis carried out in a 500-plus bed acute care hospital in Queensland, Australia, the Sharps Caddy saved over $46,000 on consumables over a 3-year period and paid for itself in 4.5 months by replacing currently used disposable trays and sheaths. The use of the Caddy was set to save the hospitals an estimated $81,000 over a 3-year period on direct costs by significantly reducing the number of needle stick injuries. This equals $127,000 of direct savings, not to mention the indirect compensation payment savings. So what do the hospital's infection control nurses, managers and finance people think? They love it too. It protects their staff and provides a safer work environment. It saves them money, and at a personal level they recognise that it saves them and their staff time, stress and anxiety. To learn more about the Sharps Caddy or other products, please visit our website at www.pdmedical.com.au.